Details at capitalx.ca.
The summer wind came blowing in from across the sea.
Welcome back to the show. Now, a lot of people just waking up this morning. I hope you had a good night's sleep, but if you or your partner snores, then you might be one of many, many thousands of Canadians that wake up less than well rested. And in fact, as I've been talking about with Dr. David Merrell this morning, it can actually destroy a marriage, snoring. And for those of you who know, you know what we're talking about right now. You've opened, Dr. Merrell, the Merrell Sleep Clinic here in Edmonton to solve this very problem. First of all, welcome to BT.
Well, thanks for having me here today.
Let's talk about this issue then. I mean, for those of us who experience it, it feels like, you know, the end of the world. How many people are actually experiencing this kind of situation with a snorer themselves or a partner?
Well, about 60% of adults snore, and the statistics are between 40 and 60% of adults over age 50 sleep in separate bedrooms because of this problem.
That's unbelievable. Now, is it just a problem for the person whose partner is snoring, or what is the detriment to the snorer themselves?
Well, a lot of people just assume that there's bad sleep associated with snoring, but it's a lot worse than that for the person that snores as well as their bed partner. Things like acid reflux, hypertension, diabetes, insomnia, obviously, all those things are related to depression, are related to snoring, because when we have sensors in the back of our throat and that measure the airflow. And if you have disturbed airflow, then it sends signals to your brain so that the brain doesn't go into the deeper levels of sleep that you need for reparative body biochemical changes. So all those medical conditions that I mentioned can result in are directly linked and have been studied to just snoring.
Now, why do people snore? Why does this happen?
Well, it's mostly an anatomical thing that with evolution, humans have evolved to have an airway that moves to accommodate speech mostly. And because of that, we've got this movable tissue that when we go to sleep and get into those very deep levels of sleep where we're relaxed, the airway loses muscle tone and the airway collapses and the tongue will drop back. And that collapsibility and movement of the soft tissues, as well as the tongue falling back, can lead to narrowing, sound, snoring, as well as complete closure and sleep apnea.
Wow, and then of course we get into dangerous territory. Now, you've got some apparatus here. We'll talk about those. Is there something that somebody can do before we get to this stage? Sleeping on your side, perhaps, or your stomach? Or?
We counsel people, everybody that comes in to see us gets a sort of a take-home sheet of things you can do at home, like to get better night's sleep. Avoid drinking coffee just before going to bed. Avoid alcohol, heavy meals, eating late in the evening, sleeping on your side, tying or sewing a tennis ball to the back of a t-shirt to keep you off your back and on your side. All those things help. Losing a little bit of weight can help for certain individuals, but it's not going to solve the problem completely.
Okay, so if you get to the point where you are not finding this to be solved, there are two things you could do to try, and the first one is called the CPAP. Can you explain that to us, please?
The CPAP is an air pump that forces air through a mask and a hose system to an individual's face like this. Yeah. And that air pressure keeps the airway open. And this technology has been around for about 25 years. However, studies show that long-term use of this appliance is only in about it ranges from 40 to 50% after a year, whereas compliance and long-term use of an oral appliance is as high as 70 to 80%.
Okay, and just because this is inconvenient, is that why people stop using it?
Well, they're both inconvenient in a sense, but having a mask strapped onto your face with the hoses does interfere with positioning and comfort when people are trying to sleep. The air pressure can dry the nasal passages in the back of the throat, and that's making patients uncomfortable as well.
Okay, so this is the second item that you were talking about, the oral appliance.
Yes, it's an orthodontic type of appliance that works on the same principle as CPR. In CPR, to get air flowing again, the jaw is pulled forward, and these appliances position the jaw in a slightly forward position that opens the airway and allows for normal air passage.
Okay, and this, I would imagine, is a little bit more comfortable, allows you to have more normalcy in your sleep.
Oh, certainly. You can sleep on your side, your back, a lot less cumbersome.
Okay. Now, what is the cost associated with items like this? I imagine some people have health plans that would cover these kinds of things, but for those who don't?
Well, the cost is around $2,000, so the cost for an oral appliance is similar to a CPAP, and most of our patients get coverage through their health benefits.
Okay. Well, it's good to know, and for people who suffer from a lack of sleep due to this, from themselves or a partner, I would certainly probably find a way to come up with any amount of money to solve the problem.
Certainly, and we've had lots of people that were diagnosed as depressed or people that have had chronic headaches for years. This has eliminated all of their symptoms and they've gotten off medication. So it really dramatically changes people's lives and makes them healthier.
Well, thank you so much, Dr. David Merrell, flown all the way up from Calgary to speak with us today. And the Merrell Clinic is now open. He is taking patients at this time to Terwillegar Heights Shopping Center, 40th Ave and 147th Street, 780-424-SNORE, which is 7667, merrellclinic.com to find out more. And I'm sure you've given relief to a lot of couples out there this morning. Thank you so much for coming in.
A pleasure being here.
Okay. Let's go into the other studio right now, someone who I'm certain does not snore at night. This is